The simulation center is now open in Waterville. The center will train healthcare professionals and more. Kadichi Lawrence toured the facility today and has this report.
People from all over Central Maine gathered for a ribbon-cutting ceremony, celebrating the opening of the Simulation Center in Waterville.
This is a wonderful partnership that Purdue Global and Northern Light Inland Hospital have entered into.
Melissa Birdie is the Vice President and Dean for the School of Nursing at Purdue Global. She says the multi-purpose facility will train and educate both the current and future workforce, which is facing shortages across the nation.
We're not in a shortage, we're in a crisis. We've been in a shortage for decades now, we know that, but we're at the point now where we've had many folks as a result of COVID leave the profession.
Birdie says we need more nurses and those interested in entering the field. And with this simulation center, they are one step closer to what it's like being on the field.
These simulators have the ability to cry, they have the ability to speak, they can show facial grimacing.
That is all due to levels of fidelity in simulation, which in this case makes it as realistic as possible.
They can display what's called cyanosis. That's when the skin becomes blue. It reflects a lack of oxygenation. It can show yellow coloring, which is often an indicator of liver failure. They can have movement, which could be a sign of neurological deficits disorder, such as an emergent seizure.
From pregnancy to neonatal care and more, Tricia Costigan, president of Northern Light Inland Hospital, says students are able to learn from each other through the space provided.
See one, do one, teach one is generally how we do things in medicine. So watching your classmate or your colleague work through an event, and then it helps you to figure out how you're going to do the same when it's your turn.
She says this will not only help the nurses and those entering the field, but it would also be available for training purposes for first responders in the community.
This is really exciting, not only for the training opportunity that it offers for our staff to have the opportunity to experience situations in the healthcare setting that they don't see every day, so our skills are on par when we need them, but it also is a great chance for us to train the community.
Kadichi Lawrence, WABI TV5 News.